am the Chief Nursing Officer at Lower Bucks Hospital in Bristol, Pennsylvania. So a lot of hard work. I have been a nurse for 26 years, and I've been a Chief Nursing Officer now for about 12 years. So a lot of hard work, working my way up to the top. I've done every kind of nursing you could think of, including the Director for Nursing Finance. So you can do nursing and finance as well. So it's just not clinical science thing. There's nurses that are in the biotechnology, information technology, so there's a lot of nursing everywhere. My favorite type of nursing was with the patients. I was on a cardiopulmonary unit, which is working with cardiac patients and respiratory pulmonary patients that have a congestive heart failure. Those were my favorite patients. I got to work with them and their families. It was very exciting for me. Even being a Chief Nursing Officer, when I go out onto the floors and I round with the patients and round with my staff, it's very exciting. Just spending time with the patients and knowing that I could still be a nurse. So they should focus on science programs, anything that could possibly get them into the hospitals. Some hospitals have work-study programs that are affiliated with high schools. I would absolutely suggest that that happens. I was actually not a candy striper, I was actually a transporter and also a unit clerk when I was in high school. From there, I progressed into a hospital and stayed there and became a nurse, and you know, that started the whole thing. So actually starting out, no matter where you are in the hospital, and then progressing from there, that's important. I think the interaction with the community. You know, when they think of Chief Nursing Officer, they think that you're in the hospital, you're working with the staff, you're working with the patients, but I do a lot of community interaction as well. We did the big, huge vaccination clinic here at Lower Bucks, where we vaccinated at least 20,000 community members. That was extremely exciting for us. It put the hospital on the map, and then on top of that, it really helped us to work with the community to make sure that everybody was vaccinated for COVID during the big pandemic situation. So it was great for us to do that. So I will give you a fun fact. I have two children that are registered nurses, so they followed in my footsteps. My son is 25 years old and he's an ICU trauma nurse, and my daughter just passed her boards and she is an emergency room nurse. So exciting fun fact for me and for you guys. But they went to a regular county college. They got their associate's degree, and I gave them the advice of go have the hospitals that you work in pay for your bachelor's. So that's what they're currently doing. So you could start off with your associates, then move on to your bachelor's. For my particular position, we need a master's as well as a doctorate, which I'm working on my doctorate right now. And to teach nursing, you need your master's degree. So, and I also teach nursing. Yes. So what I usually suggest if you want to go into nursing is to either become a unit clerk, a PCA, which is our patient care associates, an ER tech, so that you get the background, because underneath nursing, the foundations of nursing is being a PCA or an ER tech, learning how to put a patient on a bedpan, learning how to draw blood, learning how to do EKGs. Those are all the foundations for nursing. And then from nursing, you kind of understand, and when you're actually in nursing school, you kind of take those things that you learned being in the field and apply it to the nursing degree and the knowledge that you learn during your clinicals. So it's important. I usually make sure that they do that, so they do have the background, and it's important. So like the work study programs, if there's such a thing at your schools, you should absolutely do that, because that'll give you the background if you really want to go into nursing or into an allied healthcare field. So yeah, definitely. Get into the hospital. We hire. So that's good. Yes, go visit the hospitals, go shadow a nurse. We'll allow that to happen. You know, even with the COVID restrictions and stuff, we do have ways of getting you into the hospital to shadow. But see if this is something that you want to go into. The worst thing that you want to do is go into a field that you don't want to be into, or, you know, that we do deal with blood, we do deal with, you know, bodily fluids, and for somebody to be afraid of that and then go already into the profession and then you don't want to do it. Go in, see if this is really what you want to do, have somebody really walk you around shadow, and then go into the profession. Absolutely. We'll give you that opportunity too. Yes, Lower Bucks is a beautiful hospital in Bristol. It's small, it's a community hospital, but the patients that we round on absolutely love it here because it is a small community hospital. We take care of everybody, and you know, we do our best to give the best quality care that we can. And from my perspective, my nursing staff and everybody in the hospital, we absolutely strive to do that. So.
Thank you so much for your time, and please, kids, look into nursing as a profession.
Yes, come visit us. Thank you.